unique with the location and the outreach activities that is being provided to a population of around 6 lakh. Our university is unique feat with 6 institutions operational under one banner. In a small village like Loni, our multi-speciality hospital provides best healthcare to thousands of people. Palavra Rural Hospital has been conferred National Award under the category of Best Institution for providing services to senior citizens and awareness generation by His Excellency, late Honorable President of India, Shri Pranab Mukherjee, at New Delhi on 1st October 2015. This place has a history of social transformation which began 100 years ago, and today the entire region has become the land of prosperity and role model for entire country. This change is accredited to our founding fathers, late Sri Padma Shri Dr. VIKHE Patil and his son, late Sri Padma Bhushan Balasaheb Vikhe Patil. Physiotherapy department was started in 1976 and to extend the rehabilitation services, Dr. APJ Abdul Kalam College of Physiotherapy was started in 1997. The institution is named after His Excellency Dr. APJ Abdul Kalam, as we are really fortunate that Dr. APJ Abdul Kalam sir visited Pravra Institute of Medical Sciences on 15th October 2005 on his birthday and distributed around 1400 flow reaction orthoses to differently able children. This college has produced nation's finest physiotherapists each passing year who are working across the globe. This institution is flourishing under able leadership of Honorable Pro-Chancellor Dr. Rajendra Vikhe Patil and Honorable Vice-Chancellor Dr. Y.M. JAYRAJ sir. This institution offers undergraduate program since its inception and post-graduation program in 2005 in 5 specialties: orthopedic physiotherapy, neurophysiotherapy, cardiorespiratory physiotherapy, community physiotherapy, and pediatric physiotherapy. From the academic year 2010 and 11, even PhD program has started. This institution has specialized center which is exclusively dedicated to provide comprehensive care and rehabilitation of spinal cord injury patients, and the center is named after Mother of Soil, late Srimati Sindhutai Eknath Vikhe Patil Spinal Cord Injury Rehabilitation Center. This institution has Linus Palme Student Exchange Program, under which the students get full scholarship to visit prestigious Karolinska Institute, Sweden, and many other universities under different programs. Before starting the webinar, we must pay our tribute and acknowledge the inspiring vision and conviction of our great visionaries who pioneered the movement of knowledge and created a future direction for thousands of our fellow beings. Our founder father, late Shri Padma Shri Dr. Vithalrao Vikhe Patil, late Padma Bhushan Dr. Balasaheb Vikhe Patil, and Mother of Soil, late Srimati Sindhutai Eknath Vikhe Patil. The coronavirus disease 2019 pandemic is very stressful for all of us. Fear and anxiety about the new disease is overwhelming and causes a strong emotion in students and in general population. Public health actions such as social distancing is making people feel isolated and lonely, which is leading to stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19. Coping with the stress in healthy way will make us, the people around us, and our community stronger. To highlight this issue and to guide us on this issue, we have Dr. Rahul Shidhaye with us. Dr. Rahul Shidhaye is currently working as a senior research scientist in Directorate of Research, Pravra Institute of Medical Sciences, Loni. He completed his MBBS in 2002 from Mumbai University. He pursued his post-graduation in psychiatry from Gujarat University in 2006. Further, he completed his master's in health sciences from Johns Hopkins University, USA in 2008. He pursued his PhD from Maastricht University, Netherlands in 2018. Dr. Rahul Shidhaye has extensive contribution to research with over 90 publications on his name. Dr. Rahul has completed more than 6 eminent national and international projects, and now he is associated in 2 ongoing projects with NIMHANS, Bangalore. And I'm happy to say that Community Physiotherapy Department is also associated with Dr. Rahul for one of the projects. It's a pleasure to have Dr. Rahul with us for this webinar on stress management in COVID-19 pandemic. Rahul sir, over to you.
Okay. Namaste to all of you. Very good morning, and thank you so much, Dr. Deepali, for that very kind introduction. I would like to start, obviously, by first paying tribute to Padma Shri Dr. VIKHE Patil, Padma Bhushan Dr. VIKHE Patil, our Pro-Chancellor, and everyone who has actually led the foundation of this work in Pravra region. And it's also a privilege being a alumni of Pravra Public School to be speaking in Pravra Institute of Medical Sciences. It's always a very big opportunity to speak in any of these forums. Dr. Deepali, I would like to thank you and the College of Physiotherapy for giving me this opportunity to speak on the occasion of World Physiotherapy Day. This is really very special because I see that it's all about physiotherapy, so it's physical therapy, and you have actually invited a person who is working in mental health, which is all the more heartening, especially on the World Physiotherapy Day, which is one of the most important days for the physiotherapists as well as all the health professionals. So thank you so much for this opportunity to speak and start today's webinar with a session which relates to stress. Now this year the theme is rehabilitation in COVID, and I'm going to spend some time on talking about how do we manage stress and other psychological issues which are associated with COVID. Just to check, I wanted to check if I'm audible and there's no disturbance or anything from my end. I just wanted to confirm before I start.
Yes, sir. Video is also clear and audio is also clear. You can go ahead, sir.
Okay, perfect. So I'll try to speak for next 30 odd minutes or so, and then would like to take as many questions as possible because it's more interesting to be part of a Q&A, a question and answer session rather than giving a monologue. Dr. Deepali, can I request you to just let me know once we reach that around 25-30 minutes mark, so that I can kind of because I do not have unfortunately, I do not have a watch in front of me. So just let me remind me of the timing. So I'll start now. Yes, so first of all, the topic of the day is stress management during COVID times. All of us, as Dr. Deepali very clearly mentioned, that this particular pandemic is extremely stressful for all of us. This is something very unique, which no one has ever experienced in our lifetimes. No one really knows how to kind of deal with this kind of a stress. But let me start asking with a simple question: Is stress very unique in this particular situation?
No.
Rahul sir, we have lost the contact, sir. I think there is network issue. Yeah. So there was a disturbance. Your video was.
Yes.
Yeah. Now we can hear you and we can see you, sir. Please go ahead.
Okay. So it's really good that the situation itself has explained the point. I was trying to say that is COVID the only reason for our stress? No, absolutely not. Even internet can be loss in internet connection can be extremely stressful. So the point which I wanted to make was it's not just this COVID which is making us stressful. It can be anything else, and we were as stressful as we are even before the COVID pandemic started. So the first point which I wanted to make was that yes, COVID is absolutely associated with stress, but it is not the only cause which leads to stress. We were stressful before COVID, we are stressful during the times of COVID, and I'm sure we will be as stressful as we are even if the COVID pandemic ends. So stress is something which is so connected with human life, and it is so ubiquitous that I would like to call it as an all-time favorite kind of a movie. So it has nothing to do with what happens in and around. It's always there. It's like a companion. So once we understand this, then it's kind of easy for us to address and manage stress. So once I have made that particular point, I would like to obviously I would not like to kind of make sweeping generalizations or say that no, nothing's happening because of COVID. Obviously, COVID is stressful, and let's recount why COVID has really led us to almost doubling of the stress. So the recent evidence across the globe points towards the fact that, let us say, if 20% of the people were stressful or anxious pre-COVID, now it's close to 40%. These are not the exact figures, but generally the research studies show that almost double the proportion of population is feeling the anxiety and stress. And why so? So I would like to say that we are generally anxious or fearful of four things. So for and four losses, so as to say. So the first loss is about loss of our health. There's a very high risk perception that one might get infected with COVID. So risk of getting infected or losing your health is one of the most important things. Now, again, this is not same across the population. You might find some people who don't care to wear a mask, who just go around everywhere, and in private they make statements that, "Ah, this is nothing. What's the big deal about COVID?" While there are others who are constantly washing their hands almost to the extent that they become obsessive, avoiding contacts, staying at home. So there are two extreme set of people, and there was a WhatsApp joke going on around saying that one set of people feels that COVID is nothing, and that there are people who are making too much out of it, while there are some people who say that, oh, why the other guys are actually kind of behaving irresponsibility. Now the joke is the common point among both these groups was that everyone thought that the other group is insane. They're behaving insanely. So that was the kind of a common point, and everyone feels that the other party is not behaving appropriately. Anyway, so the risk perception about contacting COVID is very high. People are worried that they may lose their health and they might have the disease. Another loss is related to the closed one, someone who is part of your family member. Or now, COVID is so rampant, and there have been so many deaths or mortalities because of COVID that I'm sure every one of us knows someone very close to us who has actually died of COVID, and this is extremely difficult situation, especially if that person happens to be very close to you. So the grief associated with the death of a close person due to COVID, that's another major reason why people are really getting stressed. So first is loss of health, second is loss of a loved one. The third is loss of the support system. So our social supports have kind of, there's a huge disruption in our overall social support system. We are not really able to connect with our family members, those who are not living with us, our close family members, relatives. Even it is very difficult to visit neighbors. It is difficult to visit our friends. It is difficult to actually go and just relax, go outside. People during monsoon, people used to visit a whole lot of places, either religious places or picnic spots. Nothing of that sort is happening. We are kind of losing that whole support system which kept us together, bonded us, and gave us our sense of security and identity. And we're losing on that. So there's a loss of social support. And the most important and quite the scary and worrying aspect is about loss of our jobs, economic loss. The economic consequences of this particular pandemic are going to be extremely severe across the globe. And because things are connected in this new world, what happens in UK, people in Brazil are not insulated by that. Or rather, what happens in India, obviously people in China and US and Australia are going to get affected. So the economic consequences are going to be extremely severe. So job losses, salary cuts, this is definitely kind of going to affect us, not just now, but more so in the coming future. So losing our health, losing a close person, losing our social support systems, and losing our job opportunities or income sources is something which is very closely associated with stress due to COVID. So till now, I have made 2 points. First of all, COVID is stressful. It is stressful because of four important reasons. But at the same time, we must understand that stress is not something unique to COVID pandemic. Stress was there earlier, it is now, and will be there forever. And why so? I mean, why stress? Why stress is all around us? So we need to understand that stress is basically life saving. Stress is life saving. I mean, this might sound a bit contradictory. You might think that, oh, stress kills. Stress can actually affect you physically, psychologically, and in lot other ways. And then why I'm saying that stress is life saving. So just think of, let us say if you are kind of going on a road, on a dark road, all alone, and suddenly you see something creeping in front of you. What's the next reaction? You become very fearful and you do something immediately. So that immediate response in anticipation of something which might be dangerous to your life is basically stress response. If there was no stress response, if there was no fear, one would not have done anything. So fear, anger at some point of time, feeling depressed, these are all manifestations of a stress response, generally to a event which is life threatening. So stress is, again, we need to understand that stress is a internal response. Stress is a response of the body. Stress is not happening something out there. External conditions are associated with what happens inside your body, but they are not really the cause of your response. So stress is an internal response, and once we understand that stress is an internal response, then then it becomes very easy to modulate it. See, if we see that things outside are leading to stress, and then it's very difficult to kind of make anything of outside things. Just to give an example, we started with this particular presentation, and there was problem with the internet. Now, if I say that internet is stressful, and then what do I do? I bang the Wi-Fi router, or what do I do? I simply have to do something which is more internal to me. And what is internal to me is managing my own response, trying to kind of address these things. And I've noticed that it's not just because we are sitting in a rural area, the internet can be a problem. Um, a few years ago, I was giving a presentation in Australia with close to 1,000 participants in the audience, and suddenly the projector went off. Even in Australia, even in one of the best auditoriums, it just went off. You can't do anything about it. So factors which are external to you, you just can't do anything about it. If we try to say that stress is because of external factors, stress is because of COVID, stress is because of X, stress is because of Y, then it becomes difficult to modulate it. So first we need to understand that stress is an internal response. It was created in human body or human system so that we could save ourselves from life-threatening dangers. Now, fortunately, our life is so secure that we do not have any physical danger, so as to say, in our day-to-day life. Like no animal is kind of coming and charging at us. Just imagine, let us say around 50,000 years ago. 50,000 years ago, in a common day, you would be kind of encountering at least, I don't know. I mean, I don't recollect my experiences 50,000 years ago, but I'm sure there must be so many things which were life-threatening. Today, how many things are life threatening? There's hardly anything. In our day to day life, there's hardly anything which is life threatening. I had to think very hard to give that example of you walking on a remote road and something crawling in front of you. Even we don't, I mean, we have even stopped walking. We are on either on our bike or we are on our in our secure automobile. So that kind of a life threatening stress is now very rare. Stress in first place was devised or was generated as a response to address these issues. Now, what has happened is our life has become so secure that all the stress we have is related to psychological issues or social issues, interpersonal issues. But we have the same mechanism to address it. So we use the that mechanism to address a stress in our interpersonal relationship while dealing with either our colleagues or with our fellow professionals or with our family members, and really that's not the best way of using the stress. However, we really cannot deny that this is what it is. So whenever someone scolds us, now if someone scolds us, or just to give an example, that if internet goes on, is that life threatening? No, it's not life threatening, but still it creates a response which is exactly the same stress response in ourselves, which means what? That we start sweating, we have palpitations, our heart starts beating faster, our breathing rate increases, we sort of get confused, we are not really able to think very clearly what to do and how to kind of take things. Our muscles get contracted, blood vessels get contracted. All that is helpful if you are supposed to run from a particular place, or if you are supposed to kind of fight someone. So in a fight or a flight response, fight, flight, or flight response, all these things are very useful and they help you to do. But in a but internet going off, any of these responses, is it going to be helpful? If I contract my muscles, how am I going to kind of? I mean, how that's going to be helpful in internet going off? Or if my heart starts beating faster, or if I start breathing very fast, that's not going to kind of address the issue related to internet problem. Or let us say we are having some discussion, and some of your colleagues don't agree to you, and they start there's an argument. Now during that argument, a stress response is not going to be really helpful. So we can say that a response at an inappropriate place and timing is harmful. At the same time, that might be okay for uh, a short duration of time, but if it persists, if the same stress response persists beyond acute timeline and becomes chronic, then obviously it's going to have physical effects, it's going to have psychological effects. So physical effects in terms of, and all of you know that chronic stress can lead to metabolic problems such as diabetes, it can lead to cardiovascular problems, it can lead to a whole lot of disorders which are called as non-communicable diseases. At the same time, it can lead to depression, psychological issues, interrelationship problems, and it can affect the overall your life. Now, how do we address stress? So that's the key important point, and really, how do we kind of take care of it? So we have said that stress is an internal response. It's a response to a event happening outside, and as a part of response, there are two things happening. One is there is activation of the hypothalamo-pituitary axis. Now, for most of, I assume that most of the participants are from a physiotherapy background or from a health sciences background. So you understand what is a hypothalamo-pituitary adrenal axis. So your limbic system gets activated, and it can actually stimulate the secretion of cortisol from your adrenal cortex. At the same time, there is a sympathomedullary activation leading to release of epinephrine, norepinephrine. So cortisol, epinephrine, norepinephrine, um, these are basically all the biochemical changes which are happening, which help you to fight stress. If they are chronic, it can be detrimental for your physical as well as for your psychological health. Now, in order to kind of modulate this particular response, in order to kind of address the hypothalamo-pituitary axis or sympathomedullary activation, what can we do? Most of these systems are very, they're all involuntary. I mean, it just happens on its own. We do not, there's no way we can kind of just put hands on our heart and say that, oh, stop beating faster. We can't do that. We can't give ourselves suggestion. No, I don't want this much level of cortisol. Cortisol go down. Cortisol go down. We can't do that. It will be as funny as go Corona go. So we used to say go Corona go, and in the same way we cannot say that cortisol go down or epinephrine, norepinephrine go down or heart rate go down. These are all extremely involuntary conditions. Then what are we supposed to do? Are we supposed to take drugs which will help them to kind of go reduce those levels? Is there anything which is under our control? So there are very few things under our control, and one beautiful thing which is under our control is our breath. Our breath, breathing is voluntary as well as involuntary. So if you don't pay attention to breathing, it will go on its own. Breathing will happen. You don't have to kind of really take care of breathing. But if you want, you can modulate breathing. You can actually take deep inspiration. You can lengthen expiration. So breathing is some kind of a connect between the body, the physical involuntary body, and your active or volitional aspect of you. So something which you can do, something which is voluntary. So breathing connects voluntary aspects to involuntary aspects in our body, and by modulating breathing you can actually modulate stress response. By modulating breathing one can modulate stress response, and this is basically the core or the foundation for most of the yoga related work. So how yoga is a stress modulator? The answer is through breathing, through pranayam. And again, pranayam is not just breathing. Prana is a different concept, but for simplification, we can just say that breathing and pranayam are same. But if you start modulating your breathing, it actually has impact on your sympathetic and parasympathetic activation. So there are a number of studies which have shown that deep inspiration and lengthened expiration, uh, alternate nostril breathing, which is anulom vilom, and different types of pranayam actually help to stimulate your parasympathetic system. Now, what, and all of you know that parasympathetic system is the one which helps to modulate your sympathetic response. So what we were talking about, hypothalamo pituitary axis and sympathomedullary activation. So if you want to reduce the chronic activation of those systems, the best answer is go through parasympathetic. And one way of modulating parasympathetic system is through yoga. Basically through the pranayam aspect of yoga. Various pranayams are associated with a good activation of vagal and parasympathetic system. Along with that, yoga also comprises of asanas. Now, asana is what we generally understand is something which helps us to uh, spend calories. Actually, no. Asana, in its very core, is basically an activity which helps you to actively relax. So, asana is relaxation in activation. So, you contract a group of muscles, at the same time, you relax another set of muscles. And if you do the asana in a correct way, then it actually leads to relaxation. So asana is a way of relaxation in action. It's very paradoxical. So it's a relaxation in action, and that's the reason why a typical yoga intervention would involve pranayam, which is breathing part, and an asana, which is a physical part. So it's a way you connect your voluntary systems with your involuntary system, and that's the yoga. That's the connection. And then there is relaxation or shavasana or meditation, which is an actual relaxation. So one way of, and there are different ways. One way of handling stress is through yoga. Another way is also exercise and different aspects, but I won't go into that just because of the restriction of time. I'll limit myself to saying that yoga is one of the best ways of addressing stress or modulate stress, and not just because yoga has originated in India or it is a cultural legacy. There is a very sound biochemical or a very scientific basis for why yoga can modulate stress. The other point which I want to make is, along with yoga, and just doing yoga on the mat for some time is not enough. One needs to be in that state of mind, or one needs to kind of carry on that particular activity almost throughout the day. So your lifestyle or your routine has to be in a way that it stimulates your parasympathetic nervous system. So throughout the day, whatever activity you do, you should be asking yourself, am I exciting myself? I mean, is this activity leading to excitation of my nervous system, or is it going to calm me? Is it going to be soothing? So any activity which is non-excitatory is relaxing, can be soothing. And just a very few things I would like to say in this is, first of all, maintaining a proper sleep hygiene, going to bed at proper time, waking up in the morning, because that's how your internal circadian rhythm is connected. Maintaining sleep hygiene, not activating yourself at the time you go to sleep. So most of us watch YouTube or Netflix or all sorts of things before we sleep. At that time we need to ask ourselves, are we exciting ourselves or are we calming ourselves? If we are exciting ourselves, obviously we are exciting ourselves. We read something, we watch some exciting stuff. If you are exciting your nervous system, how are you going to relax? How are you going to sleep? And that's very counterproductive then. So engage in activities, especially before going to sleep and after waking up, which are more calming, which are more soothing to your internal nervous as well as all of the systems. Diet has a, again, it's a huge topic, but very quickly I would like to say that when do we eat, how much do we eat, and what do we eat, everything affects our state of mind or our nervous system. If we, and I have lot many patients who come to me and say that, "Oh, sir, I feel very disturbed and there is I have acidity because I have very difficult timings of work. I eat at around 11 o'clock in the night." If anyone eats at 11 o'clock in the night, obviously you are going to have problems. So it's a no brainer. I mean, if you do not follow the proper timings of having meals, or if you eat things which are very spicy or very hot, or with not so much of nutritive value, then certainly it's going to affect your nervous system. And another way it affects is through, it affects your gut microflora, the gut microbiome. It's kind of new area of research which says that what you eat affects the bacterial population in your gut, which indirectly has impact on your mood and everything else. So, for example, eating curd. Now, eating curd actually helps you to maintain a proper microbial flora in your gut, which has a very positive effect on your brain and other nervous system functions. Just an example. So, your sleeping pattern, your diet pattern, most importantly, your activity pattern. So, you do yoga for, let's say, half an hour a day or 1 hour a day, and then rest of the day you are just sitting on one place. That's not going to be helpful. Your physical activity throughout the day is a very important marker. In fact, a very recent study has said that pregnant women who were physically active had almost half the chances of becoming anxious due to COVID-related issues. And this was a Canadian study, and I'm sure this can be replicated across the globe. Physical activity is a very important marker of your nervous system, or the way your mind works. And finally, what your thoughts are, what in what kind of thoughts you are engaging. Are you engaging in the same kind of thoughts? What kind of people you are interacting with? Are you interacting with people who excite you or who kind of soothe you? That all kind of matters. So whatever you do in your daily routine is all important for your mental health. So how can you modulate stress? There are two ways of modulating stress. One is through a very active practice of yoga, because yoga has a very strong component of pranayam, which connects with your involuntary systems. It has a component of asana, which helps you to connect with your physical body. It has a component of relaxation and meditation, which helps you to modulate your thought processes. So one is active practice of yoga, another is active or kind of very careful understanding of your daily routine. So if you maintain your daily routine in a way that you get up at a proper time, engage in some kind of a physical activity which is rigorous, have your meals at appropriate times, which is around like one meal in the morning, one in the in sometimes in the afternoon, and one in the evening, early evening or so. You are cautious about what you eat. You're cautious about the amount you eat, uh, and then you're also mindful of what all things you're engaging throughout the day. Things which are more constructive, which are more which enhance your social support, or things which are simply exciting for the sake of it, and which make you very tired after engaging in them. One needs to understand that. So my proposed solution for this is following something like a yoga charya. So follow yoga, follow dinacharya, and you can combine it by saying follow yoga charya. So I'll just summarize very quickly. So the first point which I made was stress is an all-time favorite. COVID is definitely associated with stress, but not unique cause of stress. There are multiple reasons why we get stressful. So managing stress becomes important during COVID, but after COVID as well. COVID particularly has led to concerns related to loss of our health, loss of loved ones, loss of our support, and loss of jobs, which makes things extremely difficult. So during this time and after that, we need to have strategies which will help us to better manage our stress. In order to better manage our stress, we need to understand that stress is an internal response. Things in the outside world have limited influence in terms of what can make you stressful. Every person's stress response is different, so there's no one thing which makes everyone stressful. Internal response can be modulated. Internal response is essentially pathways such as hypothalamo, pituitary, and sympathomedullary pathways, and that all can be modulated. And best way of modulating, or one of the ways of modulating that, is through following a yoga charya. That have an active practice of yoga, have an active or have a very mindful lifestyle or a daily routine or a dinacharya, which follows appropriate physical activity, appropriate diet, appropriate sleep, appropriate engagement in leisure, as well as engagement with other people. So through the I would like to conclude here. I'm not sure what exactly the time is, but whatever we have remaining time, I think it will be good to kind of give it for question answers. Thank you so much. Over to you, Dr. Deepa.
Thank you so much for your wonderful explanation about how to deal with the stress. And I think, sir, it was modulated in your mind, so you have spoke exactly for 30 minutes. And I feel that initially when we started the session, the internet connection really gave us some stress. So I feel that we will remember that how to deal with the stress because of that situation. Now I request the participants, if you have any questions, you can ask, sir, please raise your hand so that we will take questions one by one. If anyone wants to ask any question, they can raise their hands.
This is sometimes extremely scary because no one has any question that you never know whether you engage with them or whether you put all of them to sleep.
It's Jasmine.
Yeah, Jasmine.
Hello, good morning,
Yeah.
sir.
Good morning.
Sir, my question is generalized anxiety order same as general anxiety or it's different?
Can you just repeat that? I missed the last part of it.
Sir, is anxiety order same or is it different as generalized anxiety disorder?
Okay. Okay. So when we kind of use this label disorder, we very specifically mean that that particular condition is leading to socio-occupational impairment. That condition is so severe that you are not able to fulfill your family role, your occupational role, and your overall role in the society. Most of us have anxiety. Almost all of us are anxious about some or the other thing. Generalized anxiety would be something which you're anxious about so many things. So some people are particularly anxious about, let us say, completing a particular task or one particular aspect. But then there are people who are anxious about far so many different things in and around them. Now, when it becomes disorder only when that amount of anxiety stops you from doing your day-to-day work. You're so anxious that you are really not able to either fulfill your role as a, let us say, as a teacher, or let us say as a professional, or you're not able to fulfill your role as a mother or a father, whatever responsibilities you have in society, uh, you are not able to fulfill them. That's the time when it becomes a disorder. So same is the answer which I gave you is applicable to uh, sadness versus depression as a disorder, anxiety versus generalized anxiety disorder, fear versus phobia, some amount of cleanliness versus obsessive compulsive disorder. So it's a general answer to anything which distinguishes a few symptoms from a disorder. Uh, Again, just to go back to our internet example, internet stoppage. Uh, Definitely, I was anxious about the fact that when the internet is going to come up. But if I become so anxious that I say, oh no, I'm now extremely anxious, I'm sweating, I forgot everything what I've said, I won't be able to give this talk. So thank you so much, and I just run off. Then that becomes then we kind of term it as a disorder. I hope this is clear now. Thank you.
I hope, Jasmine, your query is clear. Now I request Mitisha, please unmute yourself and you can ask your question.
Thank you, sir.
Good morning, sir.
Good morning.
So I wanted to ask, so what can we do for stress that is caused by repeated learning from online lectures, since rather than the classroom teaching and learning?
Okay. So I think the best people to answer this would be your if you are part of this college, then probably your teachers would be the best people to answer this. If you are not part of this college, obviously it's still a very valid question which everyone would be facing. See, first of all, to address stress, it's really critical for us to understand that some things are simply inevitable. For example, COVID is inevitable. There's just no point in getting too stressed about the fact that why there is COVID, uh, due to COVID, why the schools, why the colleges are not working. Um, this is inevitable. what we call in Sanskrit as apariharya. So something which is apariharya, there's just no way you can. So one is accepting. So acceptance of the fact that this is inevitable and you have to live with it is one way of. It's definitely one way of mitigating it. Now, coming on to the practical issues, online learning. Obviously, during most of these online sessions, you're not really able to. The internet is not working, or you're not able to pick up some of the things. So I would suggest that it's good that if you are able to spend some time reflecting on what has been taught in our teaching or in our learning. I mean, during our education, we never think of reflection as a way of learning. Most of the times, we are either reading, we are constantly reading, and especially in health sciences, people are just sick of reading. They keep on reading one thing after another thing, or writing. So reading and writing are the two skills which we have been constantly taught. But no one teaches us about reflecting, how to reflect, how to think, how to synthesize some of the things in our own way. So one way to address, again, there are multiple ways, but Nikisha, I would say that start this practice of reflecting. And again, yoga and other methods help you to reflect better. Just to give another example, I had to give this particular presentation. Now, when I had to give this particular presentation, I had an option of whether I spend a lot of time preparing slides and putting everything on slide, or I keep something more flexible, more open, and I spent almost 2 hours only reflecting about what I'm going to speak. Now, how that is helpful? That is, see, first of all, what happened? I connected through my laptop. When I connected through my laptop, my camera was not working. And then I had to move to my mobile. Not just that, I had to shift my whole location. I had to move from one room to another room. And this all happened in 5 minutes. Now, if I had made my PowerPoint presentations, it would have been extremely difficult for me to to manage that. So my whole preparation for this particular lecture was based on reflection. And reflection probably is the way in which we can address some of these issues related to learning. So think about this, and if you have more questions, you can always email it to me.
Thank you, sir.
Yeah. Shreyas, you can ask your question. Unmute yourself.
Good morning, sir.
Good morning.
So my question is कि we are at home and we are all also studying, but during this online lectures sometimes we get more anxious towards our parents because our parents come in between and ask us what are you doing on continuously on the mobile, because some of them don't know what are we actually doing. So that becomes a problem. So how to handle that, because I am a anxious person, I get angry very early.
Okay. So again, as a parent, see, until the time you don't become parent, you cannot really experience what the parents go through. So many a times it's very difficult to really understand why the other person is anxious. And again, not just for parents, but for most of the people, we won't be able. We are not in a position to understand why they're anxious in first place. But that's okay. We don't have to understand everything. But just try to kind of think that for whatever reason your parent is anxious. See, your parent may not be anxious about whether you are attending online class or not. They are anxious about something else. They are anxious about, let's say, their own job or their own issues or something. It might reflect when they speak to you. It might reflect on your own whether you attend it or not. So one thing needs to understand is whatever people say as they are anxious, they may not be anxious about that particular thing. They may be anxious about something else. One. Second, if they are anxious, that is their problem. Meaning not your parents. I'm saying that generally anyone who is angry or anyone fearful or anxious, something comes to you. Now that something coming to you is your problem, definitely, but their anxiety is their problem. You cannot do much about it. But what you can do is you can do a whole lot of things about how you respond to them. And if you respond to them in exactly the same way they have kind of, so they are anxious and you respond in a reverse anxiety, it will only create chaos, which generally what it does. So lots of chaos are created only because if someone shouts at you, you respond in another shout. That's not going to solve the problem. That point of time, you just have to pause a bit, pause, reflect, and simply take a 5 minute pause, 5 seconds pause, and then decide what is the best response in this particular situation. What kind of response I give will be able to not escalate this a lot. And in order to have this ability, again, as I said, this ability is achieved by various activities, as I mentioned, yoga, exercise, other physical activities, maintaining a daily routine. So if you keep on working on this, your responses will be more appropriate and not a shout for a shout. Just like Chinese army, let us say Chinese army does something and Indian army also starts doing it, it will result in a war. That's not happening. That's not happening. That's not why it's not happening, because there is some kind of a appropriate response. So next time when someone is anxious on you, not just your parent, anyone is anxious on you, that point of time, just ask yourself, am I doing right or wrong? See, if you are there, it's possible. I'm not saying you are doing it. It's possible that an online lecture is going on and you are on WhatsApp or you are on Skype. And again, it's not unique to you. It happens with anyone. My son also does that. So my son is attending the class and on the other side is Skyping with me. And I'm aware of that. But I'm not anxious about that fact, but it's possible that you might be doing it. You have to ask yourself, is it appropriate or not? And if you feel that it is appropriate, you got bored of the class or you understood whatever was told in the class and then you are doing it. And if you are satisfied with your own answer, it's fine. But if it's not appropriate, if you are caught doing something which you should not be doing, in a sense, you are caught chatting when you should be attending a lecture, then I think it's a good wake up call. Your parent being anxious about that particular thing is a good wake up call. Maybe that's an opportunity for you to make some amends in the way you do it. I've given you, see, I've not given you a straight answer. I've given you multiple things here and there, and you can think over it and try to make an answer for yourself. Because giving a straight answer is, I don't think it's good. Thank you.
Answer one more question. Um, sir, as you are saying that yoga, physical activities helps in stress. That what can we say? At what proportion it helps us in that physical exercising or a physical fitness gives a mental fitness too.
Um, Again, unfortunately, I mean, the science has not really reached that end where we can say that practicing 30 minutes of yoga for 5 days will lead to a 20% reduction in your stress. We don't have those kind of estimates, but broadly, the estimates are that if you regularly, as in every day, if you practice for at least 3 months, regular practice of yoga for an hour or so, then after 3 months, there are certainly very positive objective changes. In anxiety and depression studies, they have found that there is close to a 30% reduction in the kind of anxiety or depression symptoms, which would not have been otherwise possible. So, from science point of view, I would like to assure you that a regular practice of yoga for 1 hour, at least for 3 months, obviously more, but at least for 3 months, can help you to detectably identify some difference. Thank you.
Thank you, sir.
Thank you so much, sir, for giving elaborative answers to the students. And I really feel that online teaching and learning is becoming a stress for everyone. I think for teachers also and for the students also. Because since our childhood, we have been trained in
On that point, I would like to make a very quick comment. Am I
Yes,
audible?
yes,
Yeah.
sir. Yes, sir.
So, one thing is that, but other thing is also that in this we are creating a divide. We are creating something called as a digital divide. Digital divide. Not all of us have equal access to digital learning. Some of us have good equipment, some of us have good laptops, good internet connectivity, but not everyone is privileged to have that. I just saw a photo on Twitter. In United States, there were two Hispanic girls sitting outside a McDonald's, actually Taco Bell's, to get the Wi-Fi spot so that they could actually connect to their schools. This is a very sorry state of affairs. So I think this is only stopgap. This is not kind of, I mean, digital learning is a stopgap mechanism. It's amazing. There are a lot of benefits of digital learning, but we should definitely recognize that it is very stressful because not all are able to participate equally. Okay.
Yes, sir. Yeah.
So what
Yes.
I would say is you can.
Yes, sir.
I'm happy for you to share my email ID with participants. If they have more questions, they can write to me and I can respond because I see a few hands raised here and there. But I think time is the limitation. You have to move to the next session. So I'm happy for you to do that. But please share my email ID and I hope that will be helpful.
Yes, sir. Yes, sir.
Okay, perfect.
Yes, sir. Thank you so much, sir. I would like to tell all the participants that tomorrow at the same time we will be meeting for another webinar on role of nutrition to improve immunity by Dr. Mabel Lamwell. And I also request all the students to participate in a health challenge, which is also given by Government of India, that is New India Fit India. On Instagram page, you can go on Dr. APJ Abdul Kalam College of Physiotherapy NSS unit page, and there you can there are two health challenges, and the information is already received by all the students. So I request all of you, you can take this COVID pandemic time, you can utilize this time and participate in the health challenge for your good health. Now I request our Vice Principal, Dr. Neeraj sir, to express vote of thanks.
Thank you, Dr. Deepali ma'am, and congratulations for organizing this webinar on a very wonderful topic. Am I audible to all?
Oh
Yes,
yes,
sir.
yes, you are.
Thank you. Thank you. I must thank our Honorable President, Pravara Institute of Medical Sciences, Dr. Rajendra, and Honorable Vice Chancellor, Dr. JAYRAJ sir, for allowing us to organize this webinar. And I'm extremely thankful to our resource person, our speaker, Dr. Rahul sir, for carrying out this need of the hour topic like the stress management in COVID-19 pandemic. Yes, it's a very, very important topic nowadays. In this topic, in this regard, I would like to say to the participants, whatever the available resources are with us, just keep enjoying with all those resources only. Just imagine what if this pandemic will happen in year 2000 or 2005. In that year, we won't be having this kind of internet facility or internet connectivity. What would happen? So whatever available resources in these days we are having, just keep enjoying with all those resources. Then automatically we'll get the stress relief. And I'm extremely very much thankful to our IT department for providing this IT facility. Thanks to organizing team headed by Dr. Deepali ma'am, and thanks to the wonderful participants for joining this webinar. So thank you so much, and we'll meet tomorrow. Thank you so much.
Thank you.
Okay, thank you so much.
I request all the participants, feedback link is sent to you all. Please fill the feedback form, which will be helpful to us for our future activities. Thank you so much once again.
Okay, thank you, Dr. Deepali, and I'll sign off now.
Thank you.
Okay, bye.